All right, welcome everyone officially. We are delighted that you're joining us for this engagement series event focused on AG's HEOR epidemiology and market access practice. My name is Milena Mareva. I am a part of AG's healthcare recruiting team. It is my pleasure and privilege to be your host tonight and to moderate this conversation with some amazing AG colleagues. So great, let's start it with our introductions. We'll start with Keziah, then go to Selvam, Viviana, and Jan.
Hello, everyone. I'm Keziah Cook. I'm a vice president in the Menlo Park office. I've been in an analysis group for almost 8 years, and I work on a variety of different healthcare cases. I've also been very involved in our associate recruiting, our analyst recruiting, and our summer internship programs at both levels.
Hi, everyone. I'm Selvam. I'm a senior analyst based out of the Los Angeles office. I've been with the firm for over 3 years now, and I joined the firm right after completing my bachelor's degree in statistics and gender studies at UCLA.
Go to Viviana and to Jan next.
Hi, everyone. My name is Viviana Garcia. I am a manager at AG's New York office. And prior to joining AG, I did my undergrad in applied math, and then I got my PhD in statistics at Harvard, and then joined AG about 7 years ago now. I work mainly on projects looking at comparative effectiveness and analyses of big clinical trial data and claims analyses, prediction models, and as Keziah, I have also been very involved in analyst and associate recruiting, and looking forward to chatting with all of you tonight.
Hi, everyone. My name is Yan Song. I'm a vice president in our Boston office. So I have been working at AG for about 9 years now, and my training was in epidemiology and medicine. So at AG, I primarily focusing on the HEOR practice and have been involved in many projects in both the real-world data analytics as well as economic modeling to support different pharmaceutical products. Yeah, I'm very glad to be part of this presentation and looking forward to talking to you all.
Thank you so much for these introductions. So I would like to kick off the conversation with a question that is likely on the minds of most of our attendees. Can you describe the HEOR epidemiology and market access practice at AG and the work that happens here?
Great. Yeah, thank you, Milena. Maybe I can start, and my colleague Viviana and Selvam can chime in as well here. So I think, yeah, most of you in the audience probably already have some knowledge regarding AG and the different practice areas. So today we, of course, are focusing on our healthcare practice. So we have a pretty large healthcare practice with over 350 consultants working in this area across different offices.
It looks like Jan's Wi-Fi connection disconnected. So let's continue on. Would like to take on Viviana or Selvam.
Have a healthcare policy.
Oh. Sorry, Jan, we had a little bit of a break in connection. But we are back with us now, and just continue where you left.
Sorry about that. So yeah, we have a HEOR practice and also market access, commercial strategy, drug safety, and also we have a research in healthcare policy and healthcare litigation as well. So on the HEOR side, we partner with a lot of the leading healthcare organizations, such as the large global pharmaceutical companies and some of the biotech companies on major health outcome issues in different therapeutic areas. And many of these are actually very hot research area in academia as well. For example, over the past 2 years, we have been working on many projects to study different COVID-19 vaccines and treatments. So we have expertise across several disciplines, including economics, health economics, biostatistics, epidemiology, and psychometrics. We also have colleagues with training in medicine and pharmacy, and also health policy as well. So yeah, over the past few years, actually, the scope of HUR research has become much broader. So if we think from the perspective of life cycle of a medical product, HUR can essentially play a role throughout the entire life cycle. For example, at the preclinical phase or phase 1 or 2 clinical trial, we usually help our clients to address questions such as the disease burden, unmet medical need in different therapeutical areas. When product move to phase 3 trial and prepare for the global launch, we can also play a very significant role there, essentially activities such as developing economic models, which is required for a lot of the market access in many global markets, and also other different research types. So when the product is on the market, we can also design studies to differentiate from competing products by conducting comparative effectiveness research, etc. So beyond these case types, AG is also very active in engaging in pro bono research. This, of course, includes both projects on the litigation side as well as on the healthcare side. So on the healthcare side, for example, just taking one example, we have been working with the Gaskio in Haiti for many years in different research projects to support HIV and the tuberculosis control. So I know this is a very high-level introduction of our healthcare practice, and Viviana and Selvum will talk about some specific examples.
Okay, I can take the next example. So yeah, Yen, thanks for the introduction. I think I wanted to add, one of the projects that I've really enjoyed working on, like Yen said, we have a really wide range of projects, and there's different aspects that, are interesting for each of these different projects. I had one of the ones that I really loved was project where we used clinical trial data to try to understand which patients benefited the most from treatment for a particular type of allergy. So this was peanut allergy. And, for just the subject matter was really interesting to me to look at, allergy, which is something that affects a lot of people. And then also, I was really interested in the technical aspect because we actually explored a lot of different types of prediction models to try to get at the understanding of the subject matter. And this included things like neural networks and decision trees. So for people who like this sort of thing, there's also a lot to learn for, things that are more statsy or more technical. So that's why that was one of my favorite projects to work on. Selvum, do you want to add yours?
Yeah. So just like Viviana mentioned, I also have experience with comparative effectiveness. I've also worked on studies using clinical trial data, claims data, and a variety of other sources. I think one project that I worked on that I really enjoyed lately was a chart review study where we analyzed medical records of patients with a very rare blood cancer. And what we did was we pooled the data from real-world patients that we had collected with data from our clients' clinical trials for patients who were tested with an experimental drug. And we were able to use different statistical models to show that patients in our client's trial had statistically improved survival rates compared to patients who were treated in the real world. And what was really cool about that finding was that the European Medicines Agency used the evidence that we generated from the study to expand access to care for the drug our client was developing for patients in Europe. And I think that is really cool to, have this impact on patients' lives directly. Definitely one of the most rewarding projects I've worked on. And just recently, I had the privilege of being co-authored with the expert epidemiologist at the firm on that project on a publication as well. And that's also been really exciting.
Thank you all for these insights and examples. It's definitely a great overview in terms of the work that happens here, and I'm sure helpful to our attendees as they're trying to map the consulting world as well as the world of healthcare analytics, and try to get a better sense of the different opportunities at AG. So one of our other goals for tonight's session is to help attendees get a sense of what it is like to work at AG. And one aspect of the experience here is our staffing model that is somewhat unusual and that we call the internal labor market. So it's a pretty distinctive structure of the environment in which our teams operate. And we wanted to introduce it to you. So I wonder if one of our panelists can share what the internal labor market is and how it works, in particular in the healthcare teams.
Great, yeah, thank you, Milena. Maybe I can also take that question too. So like Milena mentioned, this is a pretty unique staffing model that we use at AG. So rather than using a top-down staffing model, we are much more flexible for consultants to essentially navigate and decide what type of case they would like to work on. So as you start working on different projects with different project team members, you will start developing your own internal personal network essentially at AG. And we'll start identify type of projects and a group of people, group of colleagues that you enjoy working with. So then you talk with your colleagues and case managers to start to know, okay, what other things are going on, what they are working on, and what work is coming in, so that as your current projects being wrapped up, you will have the flexibility to choose your next cases, essentially. Of course, this process may not always be easy, so we have a very robust system to help you navigate the internal labor market, including support from our office staffing coordinators, your advisor, and also leveraging, we have this regular staffing survey as well, indicating your availability, so we can match the availability to the incoming cases.
Terrific. And so can you give us a sense of how many cases do you typically work on at once, and how long do they last?
Yeah, and I can take that question, Milena, thanks. As you can imagine, just from the nature of consulting, the answer is that, it varies a lot. Maybe at the beginning you have 4 or 5 projects, you start to get trained on the basics of the types of the projects that we work on, the best practices, programming, communication skills, and kind of setting the stepping stones to just get a feel of what you like and, the skills that you want to develop. And then, afterwards, you may be working on.
Oh, it looks like we have another connection break. Sorry about this. So we'll continue with
that you're making your contribution a lot bigger. And I think in terms of the length, again, it also varies a lot. There are some studies that say, for example, we do primary data collection and perspective. Those can last a few years. There are others like administrative claims analyses. Those can take, somewhere between 6 months to a year. Usually, we get the data, do the cleaning, do the analyses, and most of them end up in dissemination. And then, there's also on the other side of the spectrum, projects that are very short, that have a quick turnaround, perhaps, a small post-hoc clinical trial analysis. And so there's a really wide variety of types of timing and number of projects that you can be involved in. So there's a lot of flexibility for you to also decide.
That's great to hear. And so in terms of flexibility, Viviana, what if you wanted to work on specific types of projects or with someone in particular?
Yeah, that's a really good question. And I think that really relates back to what Jan was talking about in terms of the internal labor market, right? So you have the ability to, inform what you want to work on. So for example, if you're really interested on a particular type of project, you can you can ask your peers what they're working on, or reach out to the project manager if you hear about the project, and, try to work on that. You should be very vocal about what you're interested in, because if there's not a particular opportunity in a given time, then, at least people will be aware that you're interested, and they can reach out to you the next time there's a particular type of project that comes in. But that will leverage a little bit of your network that you start to build. But like Jan was saying, there's a lot of resources that can help you kind of navigate that. So there's an advisor that you will be assigned to that can also help you make those introductions if needed. There's the staffing coordinators, there's your peer mentors. And so, it's very flexible. And you have a say on what you want to work on. And if you want to work with a particular person as well, it's also good to have people that you like to work with, regardless of the type of project.
Thank you. That helps clarify things. And so in terms of, having the opportunity to specialize in specific areas, do associates and analysts remain generalists within the practice, or do they tend to specialize? Does anyone want to take on that?
I can take that one on. I'd say it actually really varies. Some people end up finding, types of projects that they really enjoy, and they end up, doing variations on those types of projects repeatedly. I'd say other people do sort of maybe more of a sequential approach, where for a while they'll work on a lot of a certain type of project, and then they might start working on different types of projects and sort of shift over. And, maybe in any given year, they're working on mostly the same type of thing, but over their full time at AG, they get a lot of exposure. And, I think there are other people where they're just sort of true generalists, and they're, they enjoy, they might enjoy certain techniques regardless of topic area, or they might enjoy, working with certain people, and whatever those people are working on, they work on too. So I think there are a lot of different ways that people end up, allocating their time across, different types of content areas, different types of techniques, and then also just different mixes of teammates.
Terrific. And thinking about opportunities for growth, how does one navigate the staffing model to create opportunities for skills development and career growth?
Sure. I'm happy to take that one too. There are a variety of tools that we can use to kind of to facilitate our own growth. I think when people first start, it's often, there's sort of an initial focus on just getting to know people. So, when you're finding your first cases, you may be trying to find opportunities to work with as many different people in your office as you can, so your priority may really be, well, let me just find a project that, this particular person's working on, maybe kind of regardless of what the topic is. I think over time, as people, get preferences, do something that they really enjoy, they may look for that particular type of project. But then I think the other thing to mention here is, you're not navigating this staffing model entirely on your own. So everybody at AG has an advisor, and the advisor can assist with introducing you to other people who do certain types of work, identifying projects that may be a good fit for skills you already have or skills you want to develop. And then also each of the offices have coordinators, both at the analyst and the associate level, that facilitate, sort of the process of matching with different cases as well. So, while you're taking a lot of initiative in finding your next project, you're not entirely alone in doing it. There's a lot of support within the firm to help you, and to help you sort of with an eye toward the long term as well.
Well, this is actually a great segue into another topic that I'm guessing our attendees are probably interested in, which is how does the firm support individual employees' growth and career trajectory, particularly in the healthcare practice, and what are the resources that we dedicate to career development and growth? I'll just frame the questions that I'll ask in a second to our panelists by saying that AG is known for really strong formal and informal processes to share guidance, feedback, resources to help analysts and associates grow in their roles. We look at both analysts and associates as future partners, potential future partners, So if, Keziah, you started us with kind of an overview of the formal advising structure. But, tell us more about these advising processes and how they have worked for you.
Sure. Yeah. So one thing that I think is really interesting and somewhat unique about AG is no one actually has a boss. So instead of a boss, everyone has an advisor, and it's a very true term. Your advisor is someone who is providing guidance and mentorship during your time at AG. So the advisor is the person who facilitates our formal review process. For analysts and associates, we do it twice a year. And that's an opportunity to get feedback from a variety of people you work with. There's a component of a self-review where you reflect on your experience for, the past period. And then, the advisor sort of consolidates this all, reflects it back to you, helps you identify some specific goals to work on in the upcoming period. But in addition to that, in addition to facilitating that sort of formal process, the advisor is actually also a mentor and someone who, helps you initially with getting to know others in the office, getting to know others, across the firm, in other offices, finding interesting work for you to do. If you run into some kind of challenge, whether it's a kind of technical, conceptual kind of challenge, or it's I have a really hard time working with this person, what do I do? The advisor can provide, guidance of maybe try this, maybe try that. And they can also just generally kind of reflect like, hey, I had this experience in the past and this is what worked for me. So it's very much, a mentoring type relationship. My advisor when I first joined, was one of the partners, and she, provided a lot of help in getting me connected with people, helping me settle in. At this point, I have two partners who are now my co-advisors, and they're very helpful. As I've tried to shift into doing kind of different mixes of work, they introduce me to other people. They point out new opportunities to me. Sometimes they're just sounding boards of hey, I really want to do this. Let me run it by you. So, over the course of kind of all of the different levels at AG, the advisor does play a really key role in, helping you identify your priority areas and helping you work toward those priorities.
Yes, I mean, these are such great examples because I definitely have found that a powerful driver for my career growth has been to have people who look out for me, right? Informal ways, but also informal, right? And because the culture is supportive of this mentorship at all levels. But we also have some formalized mentorship relationships like peer mentoring. And so I'm curious if some of you could describe what some of the peer mentor relationship is like and how it has been meaningful to you, and how it is different, I guess, from the advisor relationship.
Mm-hmm. Yeah, Milena, I'd be happy to take this one. I have been fortunate enough to collaborate with a number of individuals in LA who have been central to my development. And one specifically was a senior analyst named Catherine, who's now an associate. She was really helpful to me when I first started. I came into AG having some statistical knowledge, but I never had used SAS before. And so working on a number of cases where we're doing programming in different languages, Catherine came to my office, she sat with me, she taught me best practices for how to code, and, gave me strategies for debugging and writing efficient code. And I think having someone, like you said, who is there to support you is really, really helpful and definitely beneficial to your development. And I think one thing that's nice about AG in our culture is, mentorship is very central to that, as is paying it forward. And as an analyst who has now been here for 3 years, I've gotten much better at SAS since I first started. And last year, I was even able to lead the SAS intern training for our summer interns. So that was, definitely a really nice way to pay the mentorship forward. And, currently I am a mentor for 3 of our analysts who just started in the LA office. And informally, I've helped a number of our other junior colleagues as well. So I think in and out of the LA office, you can really connect with your colleagues, and it's really made a difference.
Those are great examples. And so mentorship and support also go beyond casework. And I wondered if you could give us some examples of how a mentorship role can extend beyond immediate work responsibilities.
Yeah, of course. So I think for myself, I have benefited a lot from both the formal mentorship from my peer mentor, as well as the informal mentorship from many senior colleagues, especially in the first few years where I needed to learn a lot of new things. So if we talk about the beyond casework, for example, I communicated very frequently with the managers and the VPs that I work with, and learn a lot from them about the general healthcare consulting industry. Because sometimes when you work on specific projects, you may lose this type of bird view of the industry. Not only that, but also the pharmaceutical industry in general. For example, what are our clients doing, right? How their different functions collaborate with each other. So I think this type of mentorship and knowledge has been very helpful for me now in terms of understanding my clients' needs and also just to provide better support for them.
Terrific. And so if some of you could give us examples, we heard from Selvum about, SAS programming, learning this at AG, but what is one skill that you have learned at AG that you have found the most useful? I know it's kind of a hard question.
Melina, I can add on to that. As I mentioned, definitely, learning advanced coding methods and R and SAS definitely integral to the analyst and senior analyst role. But I think outside of that, I think one skill that I've learned, especially in consulting, is how to think about the bigger picture of our clients' goals and our research objectives. And what I mean by that is, as an analyst, you're the closest to the data. You're deep in the weeds of the data, you know how it's structured, you're running different transformations and models. And I think sometimes it's very easy to get carried away and, what if I try this model, or what if I use this covariate or this method? And I think through some of the feedback that I got working on my teams over the last 3 years, it's really important to be able to not only have adequate context of the data that you're working with, but also be able to zoom out and know when those efforts are worth it, and also understand why the methods you're using are the ones we're using and how those help our clients reach their goals.
And I'll just chime in as well. I think one of the things that I found really useful kind of as I've progressed at AG, and also something that I think I see, new analysts and associates, developing right off the bat, is the ability to manage time effectively and to prioritize multiple, work streams and multiple projects. So within the healthcare practice areas, most people are working on multiple projects at a time, and none of us have bosses. So every day we are faced with the need to determine, what are the important things I need to work on today? Like, what has to get finished? What are my deadlines? What do I need to keep moving forward, even though there's not a deadline, so that it's not too crazy for me, next week or the week after. And I think the exact nature of this changes over time, but it's a skill that I think our staffing model actually sort of means that pretty much everybody has to work on this and has to get good at it. So over time, I feel like I've gotten better at it. I feel like I have fewer last minute scrambles because I forget something that needed to get done. But it is a constant, thinking through, how do I need to be spending my time, today? How do I need to be spending my time this week? How do I need to be spending my time over the next, several months or over the next review period to kind of meet both the short-term priorities and to keep moving forward long-term goals?
Thank you for these examples. They're great. So as the next topic, I was thinking that as you're exploring an organization, sometimes it's very hard to get a sense as an outsider of what its culture is like. But it's such an important piece, and it defines in many ways one's experience. So I have some questions for our panelists that will hopefully help us get to know AG's culture better. So how would you describe AG's culture? Does anyone want to take on this big topic?
Yeah, I'd be happy to chime in here. I think AG's culture is deeply rooted in collaboration, the rigor of our projects, and also mentorship, which we've already discussed. I think one of my first experiences working on a case at the firm, I remember that I had proposed a visualization that I thought would neatly show the data that we were trying to, sell to the client. And the manager really liked it. We ended up showing it to them and using it in a deliverable. And I think having that as one of my first experiences was really meaningful. I think what's been true for me over time has been that, no matter where ideas come from on our projects, be it from the analysts or the partners, that those ideas are always valued. And that's been true from when I started until now. And, thinking about like the rigor of our projects, I think that's also very central to the work that we do. I think especially in healthcare, we rely a lot on very detailed statistical analysis plans and protocols that involve working with messy data and complex methods. So I think someone who has an eye for detail and someone who is very not only detail oriented, but also methodologically curious, those are the types of individuals that we see at AG in healthcare and succeed the most.
Terrific. And what about from the perspective of diversity and inclusion, which is such a core value at AG? How does the firm support it?
Mm-hmm. Yeah, there are a number of DEI initiatives that we have at AG, both internally and externally. So internally, the first thing that comes to mind would be our different affinity groups. So for instance, there's AG Pride, which I'm affiliated with. There's also Black at AG, AG Women, and Asians at AG, and many more. And I think that's really nice, having access to people who have shared experiences with you and someone who can relate to, what you're going through and the work that you do as well. So having that support system has been really valuable, especially for a firm as big as AG. We have over 1,100 employees now. And so being able to connect with people, not only in the LA office, but in Boston and in London, I've been able to meet other people through those groups as well, which has been really cool. And then thinking about the external part of that in terms of recruiting, AG does a number of really wonderful recruitment events, incorporating DEI. I know just last year I had helped at a job fair for undergrad, which was a job fair for LGBTQIA identifying people who were looking into getting into economic consulting at AG. And so getting to interact with those students, explaining the work, that's something that we do quite a lot of at the firm. I know Out for You is something we've done for the last 4 years. We now have an externship for sophomores in college who, are looking forward to pursuing a career in consulting and come from underrepresented communities. So we definitely do quite a lot on that front.
Perfect. And so what about fun events and team building activities that your office does or your teams usually do? What are some of them, and what is your favorite social event or AG social event memory?
Maybe I can get started and give a few examples from the New York office. So I think, one of the nice summer events that we do every year is we go to the US Open on one of the first few days of the tournament. And so we're able to, see a lot of the games and have food and just, meet with colleagues. And it was nice to go back this year after the COVID pause. But, we have usually another a baseball game also in the summer. And in the past, we've done, visits to, say, museums. So, for example, we went to the MoMA once after hours, and we basically have the whole museum to ourselves, and we can even see Van Gogh's Starry Night without all the crowds. So those are like my personal favorites for New York.
Yeah, maybe I can talk about the events in Boston. So Boston is a pretty big office, so we have many events. Just for the ones that I can think of, for example, every summer we will have a summer party. I think from last year it's been in the Franklin Zoo at Boston. I feel I like that event a lot. It's usually just very nice weather outdoor and just a very relaxing environment for to mingle with your colleagues. And also at year end, every year we have the holiday party for the entire office at the Museum of Fine Art at Boston. yeah, that's a great event as well. So besides that, office level events, we also have many, for example, associates events, analyst events. We also have healthcare team events, just a lot of fun activities.
I can
Yeah,
I can chime. Oh, go ahead, Selman.
Okay. Yeah, in LA, we do a number of fun events as well. Like Yan mentioned, we do events for the whole office and also just for the healthcare team. I remember one event we did for the healthcare team. We did a virtual escape room, and that was a big hit. And I think we're looking forward to doing one in person early next year. But one we just did in October that was really fun was we all went to a Carly Rae Jepsen concert together, which was really fun. I think a lot of us really liked her music, and we were just talking about it at lunch one day. And then we were sitting with one of the partners and they thought, well, why don't we all go to her show? And, her show was happening the next week and we went. And that was the first time I'd ever been to a concert with my colleagues, but it was a lot of fun. And I think we really enjoyed it. The admin staff put in a lot of effort planning it for us. And I think, that's just one of the many fun things that we've done in
LA. So I'll mention a couple of things that we do in Menlo that I found particularly fun. One is every fall we have a summer event, and our summer event is in the fall because our best weather in the Bay Area is always in September, and usually these end up being something that's just a little bit competitive. So one year we went go-karting. This year we actually we did. It was a variation on golf. It was like Top Golf. I don't know if anyone's ever done that, but it's like a combination of bowling and golf. One year we actually all went bowling together, but there's always this aspect of competition going on, and inevitably whatever team the partners are on always wins. So, but they're always a ton of fun. The competition is very friendly, but it's something different. It's something out of the office, and it's a way to learn about some skills your colleagues have, beyond their mad skills at Excel, that we see every day. Another thing we do every year, or at least pre-pandemic every year, is Bruce, who's one of the partners in Menlo, hosts a big picnic in his backyard. And so the whole office, will come over. We usually do this during the actual proper summer when our summer interns are still around. And we all have a big picnic in Bruce's backyard, and everyone really, I think's had a great time with that as well. So it's all these events, I think, are just, they're nice ways to just spend a little bit of time, with our colleagues. Some of them actually are opportunities to bring our family as well. So Bruce's picnic has often included families. Our Christmas party is, a chance to dress up and, bring your plus one along and have a chance to kind of mingle with everyone and, shut down the dance floor if that's your thing. But yeah, I think it's a really nice part of the year, and frankly, something I think we're all looking forward to resuming as the pandemic has ebbed.
Wow, it makes me want to visit each of these offices during the special events. But hopefully it gives you a sense that AG is a community, and each office is a community of its own. And there's plenty of fun going on while we work together, but also when we party together. I should also mention there's always great food at AG all the time, constantly, and lunch is served several times a week at a lot of the offices. So moving on to another topic that I am sure our prospective candidates would be interested in is our summer internships. Internship opportunities are something that we get a lot of questions about, and we wanted to share some more information about the structure of the program as well as about the typical intern experience. So AG hires summer analysts and summer associates into a robust 10 to 12 week internship program, and we intend for these interns to have the responsibilities and contributions of our typical full-time analysts and associates. So interns are actually staffed on at least one case team where they are able to make tangible contributions. They also receive a lot of exposure to AG's work, staff, culture through a lot of training sessions, both in terms of technical and soft skills, practice area overviews, their informal meetings with staff. They are invited to all the social firm outings. And many of our interns receive and accept offers to return to AG upon graduation as full-time employees. So we'll spend a little bit more time toward the end of this hour looking at a slide with all of our application deadlines. I'll just mention here that our internship application for healthcare summer associates will open tomorrow, November 3rd, and the internship application for healthcare summer analysts will open on November 21st. And both of these will remain open until February 5th of next year. So in terms of the actual intern experience, I would like to invite some of our panelists to give us some detail and help us imagine what the internship program is like.
Sure, I'm happy to talk about this. So I think Menlo Park's a smaller office, so it's a sort of smaller group of interns than in some, but in a typical summer, we have, I'd say between 6 and 10 interns. And typically, that's probably mostly analyst interns, and we'll maybe have 1 or 2 associate interns. The interns do, I'd say sort of an abbreviated version of the trainings that we offer to our full-time staff. So there's some Excel training, there's some SAS training, there's some R training. There are also opportunities to, just share more about types of casework. So we do some overviews of various cases that we've worked on in the past. We arrange a series of lunches, throughout the summer, typically with kind of more senior people in the office, where each of the kind of lunch hosts will describe the types of work they've done and try to give some more, information about, how they got to where they are and sort of, their type of work at AG. Additionally, our interns also have advisors. So we have actually various summers I've advised the healthcare analyst interns. The past couple of summers I've been advising some of the associate interns. And so for the summer interns, the advisor typically will meet with the advisee once a week and really, check in, provide feedback, provide guidance. We do conduct reviews. It's a little less formal than for the full-time hires, but the advisor does sort of a mid-summer check-in where they reflect feedback from the case team members, the various trainers, various others within the office that have interacted with the intern. And then there's end of summer feedback as well. In addition to that, as Melina mentioned, we staff the interns on real cases. And, the exact cases depend on what's going on in the office during the summer. Sometimes the analysts will help with the very start of the case. Sometimes they'll help with the very end of the case, so when cases end, there's often a ton of work that has to get done to finish. And the interns are great at just jumping in, helping out, cross-checking all kinds of things. Sometimes someone will contribute to the middle of the case, so they missed the start, they missed the end, but they did a nice chunk in the middle. And across the 10 to 12 week experience, we try to help people get exposure to a variety of different cases, so there might be the case team they're actually working with directly, then they might help out, with a couple other projects. We've also done shadowing, where basically each intern will shadow one of the full-time analysts or associates for a day or two to just kind of see, okay, what all are they working on? What's that like? So our overall goal is frankly, we do want the interns to help. The summer's a busy time for us, and the interns do really meaningful work that help. But we also really want it to be an opportunity for the interns to get to know AG and get to know kind of the scope of the different work we do. And then I guess I will just make a final note that we also organize a lot of fun things for the interns. So in previous summers, the interns have all gone kayaking together. We've gone to Giants games. We've done some really nice like end of summer dinners, for all the interns and the advisors and the peer mentors. There's just been, I think, a nice mix of different types of activities that help the interns get to know each other, introduce them to, other members of the office, incorporate them into various, analyst and associate activities that are going on and whatnot. And there is tons of food throughout the summer, tons of food.
Again, same theme. Terrific. Well, thank you so much for kind of bringing to life the intern experience, Keziah. So before we head into our Q&A session, and I encourage our attendees to start thinking of questions and submitting these through the chat, I want our panelists to share some advice for students who are currently in their undergraduate or graduate programs, trying to figure out their career paths, considering AG as one of many options. What advice would you share?
Yeah, Melina, I can start us off on this one. I think if you're here today at the AG event and you're interested in AG, I think we can probably assume you're interested in working with data. So I would say start there. Think about what excites you when you work with data. What kinds of data do you like to work with? What kinds of programming languages do you like to use? And maybe more broadly, what kind of research questions are you interested in addressing? And then I would say use that to lead your search, wherever it may take you. I think for me personally, I had some experiences working in healthcare consulting and in patient-facing roles at the UCLA Health System, which really motivated me to learn more about healthcare data, and that's what brought me to AG. So I would say do some research and really think about what you want out of your work experience, and hopefully that's AG.
Yeah, I totally agree with Selvon. So I just want to echo. So I would suggest just to spend some time, think about what you enjoy, what you like. I think for AG, it's a good fit for people who are very interested in quantitative analysis and also interested, of course, in the medical research or healthcare research, the subject matter in general, and also prefer fast-paced but robust and solid research environment. I think at AG, we'll have a lot of opportunity to learn new things and new knowledge. For example, for myself, before I joined AG, I didn't really know the economic modeling or, for example, cost effectiveness analysis. This is something I really learned from doing many cases with my colleagues. So yeah, so besides that kind of hard skills and also soft skills, right? You will learn a lot of things in like communication, including communicating with your team members and at a later time with your clients, teamwork, coordination, time management, etc. Yeah, so it's a very rewarding learning experience as well.
I guess I'll just chime in and add that, consulting can be a great fit for people who are very curious and who really enjoy learning about new topics all the time. I think in the context of our healthcare work, this is often an opportunity to learn about a bunch of different disease areas or a bunch of different types of products, or even a bunch of different, ways in which the healthcare system affects everything. And I guess, the other thing that's probably most relevant to, to our undergraduate attendees, if you are thinking about doing graduate school or especially a PhD program at some point in the future, spending time at AG as an analyst helps you build a lot of skills that are extremely useful in completing a PhD program. I personally did my PhD right after undergrad, and I think it took me at least a year longer because I started, with no work experience, none of these skills with time management, with prioritizing, with identifying, how to answer specific questions. And, and I see it in our analysts after they've been analysts for 2 or 3 years, they just have those skills down pat, and they go on to top PhD programs and do very well in those programs. So if you're thinking you might want to do a PhD, but you might want to go into consulting, AG is actually a really good preparation. So worth noting.
Terrific advice. Thank you all. So at this point, we'll start taking a few questions. We have time for a few questions coming through the chat. And then, of course, we'll go into the breakout room so you can continue asking questions there. But I see a question here about the onboarding process for associates, but why don't we extend it to both analysts and associates? Does everyone start together, or are they, in cohorts or individually? How does the onboarding experience work, if anyone wants to take that?
I can talk a little bit about that.
Go ahead.
Yeah, I mean, I think it really depends. We usually try to. There's a group of people that start usually around the same time. Sometime in the fall or earlier in the summer. And so usually what we try to do is, there's kind of a few training sessions that occur at the same time for everyone. So there's Excel, SAS, R, and general communication, best practices, whatnot. And so there's opportunities there for people to take those classes together and kind of form a cohort. And I think what's really nice about that is that you create these connections, and regardless of whether you're working with your colleagues on projects or not, you're kind of experiencing the same initial feelings about a new job and trying to figure out how things work and how to answer questions. And so it's always nice to have that kind of support from your cohort. And I think that's, for me at least, that's something that's lasted throughout the years. There's still a few people from my cohort that I'm really close with, and that we continue to try to figure things out as we go together. So yeah, I think there's a lot of like this cohort feeling, and I can I'm speaking about both analysts and associates.